given medicine because it's considered medication. And so you need to follow all the rights of med administration that you did on your PO, your medication comp. So you're going to have an order and an MAR just like you did in that, and you'll compare the two, make sure your MAR is correct, and then you can do everything from it. Your order will say D5 to infuse at 100 milliliters an hour, or it may say 1,000 milliliters of D5 to infuse at 100 milliliters an hour. Either way, you want to take the 100 milliliters an hour times the drop factor, which remember is on your tubing, divided by 60 minutes in an hour, and you'll get drops per minute. So y'all both know that it's just memorizing the formula. Just don't, if you get the 1,000 milliliters of D5 at 100, don't let the 1,000 mess with you. You got to use the milliliters per hour. Basically, use your common sense. If you do your drug problem and you get 300 drops per minute, that's not right. There's no way you could count 300 drops per minute. I don't think you could anyway. So you'll do that first. After you check everything, make sure your MAR is right, you need to do your drug problem, and you'll come up with however many drops per minute that you get. And then, so my order is for, what do I got? Normal saline. So I'm going to get my normal saline. Make sure that it's normal saline because that's what it's ordered. Tell them you've checked that, identify that 3 times. You don't have to stand there and go normal saline, normal saline, normal saline. Just tell them you'd identify it 3 times. Looking for the expiration date, and this one it's on the back. Usually it's in one of the corners, but it's on the back. If it is expired, that's okay. We get a lot of donated stuff, and it's donated because it's expired. So don't, just so long as you're checking it, then you can pretend that it's okay, even if it isn't. It should be clear. Shouldn't be yellowed or brown or pink. It should be clear. It shouldn't have anything floating in it. So once we're sure that that's okay, we'll get our tubing. I will say, okay, they're going to watch you 2 at a time. Did they tell you all that?
Yes.
Okay. I just don't want, some people get freaked out when they find that out. So they just kind of go back and forth and let you do your thing. So anyway, at the end of the hall in 254, which is right across from 253, is where it is. And it's a long room. And it's got little cubicles. You can't see the person beside you. But you'll hear me when I'm talking. I'll say in the nurse's station, in the patient's room, you really don't go anywhere.
Mm-hmm.
But just like we try not to drop shots up at the patient's bedside. We try not to do all this at the patient's bedside unless we, have to. It's an emergency. But so we're going to go ahead and get our bag ready. When you open tubing, and if it's got an alligator clip in it, we don't use those anymore. But when you open tubing, first thing you need to do is take your roller clamp and close it. So that means roll it all the way down. So that's the first thing, whether it's this tubing or whether it's medication tubing next semester, when you open your tubing, close the clamp. That's just so that if you get nervous, you don't spike it with it wide open, because if you do, you're going to get air from one end of the tubing to the other. Now you can fix it. It doesn't mean you're going to fail. Just if it does happen to you, it just means you got to take the time to get all those air bubbles out, and it's just going to make you nervous going through that process. So, want to make sure there's no kinks in it, which means doesn't necessarily mean a roll, but if it got like smushed in the box and it looks like it's not going to flow, then that's what they're talking about. Caps on both ends. We're going to leave this on when we spike our bag. That way, because it'll prime around it, and that way you don't have to worry about what it touches, because you need to keep that sterile, right? That's going to be hooked into somebody's arm, and it will be invasive. So I have my roller clamp closed. You want to pull off the one that has the piggy tail on it. This was to add medicine. It will eventually come off if you pull hard enough for long enough, but it's not that. This may be white, it may be clear, it may be blue, but it has the little piggy tail, and sometimes it's hard to get off. You just keep pulling, it'll eventually come off. Alright, off with that. Now, same as putting needles on syringes, because this is going in somebody's arm, you can't touch anything. I don't need gloves on right now either. But you want to be careful when you're inserting that you just hit the inside. Then if you push and turn, once it gets started, it'll go all the way to the little edge right there. Come on.